talking about diagnosing prostate cancer. But one of the great fears men have is the treatment of prostate cancer and the side effects. It's such a big deal that I've seen bus ad posters about treatments and less so-and-so occurrence. So let's talk a little bit about the side effects and why maybe you shouldn't focus too much on them as well.
Correct. So when we're specifically talking about prostate cancer treatment, that obviously by then that's not something that a primary care physician should be managing completely. Hopefully by then you're in the hands of a urologist, you're in the hands of a proper urologic team. There's been the appropriate diagnostic workup. Just because your PSA is going up and your prostate size is changing does not necessarily mean that you have prostate cancer. So I wanted to make sure that you understand that the diagnosis matters. The aggressivity, maybe that's not a word, but how aggressive your prostate cancer is very, very important because that may change what your therapeutic and treatment options are, whether they are completely medical, whether they are surgical, and so forth. And that's what our urologist specialists are for.
So not all men who have prostate cancer need surgery.
No, definitely not. And again, that's the potential benefit of doing these types of tests. One thing is, we spoke previously about screening, and a screening test is trying to prevent the disease altogether. One thing that these tests, like rectal examination, PSA, etc., do show is that maybe we're able to diagnose it earlier. That doesn't necessarily translate to less people having prostate cancer, but definitely there are opportunities to diagnose it earlier. If, let's say, you're having urologic symptoms, your PSA starts to go up, and your rectal examination is starting to change. So those things are important. And the earlier you catch this, then the less, let's say, side effect prone maybe your treatment may be.